Welcome back. Well, as you know, Americans are turning to telemedicine in record numbers here in 2020. Joining us this morning is Dr. Charles Van Duyne from Wellmed to share what we need to know this morning when it comes to this new way of healthcare. And doctor, it's a learning curve, I think, for all of us, but it seems like a lot of people are responding pretty well.
Right, and thank you for having me. So yes, they definitely are. We've done nearly 100,000 visits year to date and have a 90+% satisfaction rate from the patients. And I mean, it's really cool because on your device in the comfort and safety of your own home, you can have a face-to-face visit with your doctor.
So let's talk about this and how it's being done, because a lot like how our TV show is being done and how we're doing interviews right now, it's kind of nice to be able to stay at home and kind of really feel like you have that intimate experience that you would in the office without actually having to go.
Exactly. And probably the main difference with our telemedicine platform is the extra security level, because remember, we're talking about personal health information, so we want to make sure it's secure. And we don't want to, for instance, be Zoom bombed or anything like that. So that's another important feature. And if you think about it, it's kind of like Amazon. They bring the product to you. You don't have to go get it. We bring the care to the patient instead of the patient having to come into us.
Now, this has been a learning curve, I think, even for the younger generation to adapt this way. Let's talk about the older population as well. Is it pretty easy for them to do this and to link in? And are they getting the link sent to them and step-by-step instructions?
Sure, absolutely. We have a lot of marketing material that tells them how to do that. But yes, the senior population, and I can say that as a senior, is underrated for their ability to use technology, first of all. Second of all, most seniors, if not all, will have a family member or caregiver who is tech savvy. So yes, it's not quite as simple as clicking a Zoom link because we have to make sure that we protect privacy. So the patient has an app on their phone. They use that app. They log in with a username and password because that protects their privacy. They go into the visit. The application notifies the provider that they're in the room. The provider joins the visit. You conduct the visit. The provider sends medications, work letters, anything else they need to do, goes over the treatment plan, and boom, you're done.
So obviously there's going to be some things that can't be done, doctor. And let's talk about testing. I feel like a lot of people, that's what's top of mind right now. What say you there?
So there is, testing is obviously we can't do testing over telemedicine. So depending on the circumstances, we have a lot of options. And what you're seeing on the video right now is our curbside testing service at our clinics. So for instance, what you can do is initiate the telemedicine visit with the doctor. And if they think it's appropriate for you to have testing, they can arrange to have that done. And you won't even have to get out of your car at the clinic.
Wow. So what's your take home for people watching today? And again, I feel like as health news changes almost daily, it seems like, what do you really want people to know and understand when it comes to taking charge of their health care?
So what I would say is like the cereal commercial, try it, you'll like it. And this is a common thing we've heard all the time. Again, it's not for every condition, but it's an additional tool in the toolbox that allows us to provide great patient care and a great patient experience. So yes, the take home is it's not as hard. If 100,000 people can do it, you can do it too.
Do you think this will be the future? I mean, do you think I can't wait till the day when this is a thing of the past as far as this virus goes, but do you think this is going to be?
Right. Yeah, I think a lot of it's going to stay as people realize how convenient it is. I mean, me personally, I see my provider once a year and the rest is all telemedicine because I don't have 30 minutes to drive there, get in the office, wait, 30 minutes to drive back. That's 2 hours out of my day that I don't really have. And so I can get all of this done over the phone in 15 minutes, which is amazing. So,
well, doctor, we know that you are very busy. Thank you so much for your time this morning. We've been showing the website where people can get more information as well. But yeah, this is the future.
It is. Well, thanks for having me on.
All right. Thank you so much, doctor. We, of course, will put all that info on our website as well.